So, Happy New Year, everybody. We've spoken a lot about how to ensure that a health system has some of the information that you need in order to implement a workable national health insurance system. Why have we dwelt on this? We dwelt on this because we imagined that fiscal space as a strategy, increase of fiscal space as a strategy, is critical to raise adequate funds and sustainably raise adequate funds sustainably for the national health insurance system. And to retain that fiscal space, it means that you'll need to know who is going to pay for health services, who is going to be subsidized by government, and who should actually be retained onto care. Now, when you have a good information system, remember that this information system needs to be improving. That is dynamic. It changes from one point to the other because the people who were poor yesterday will not necessarily be poor tomorrow. And the people who were poor, who were rich yesterday, sometimes it just takes one or two illnesses to make them fall into catastrophic spending. So, for that reason, this database needs to be updated until such a point that you will say that you have mastered your system. This is different from what the new or advanced health systems called the unique patient identifier. You know that an information system at a national level on the individual is a bit different from the operational database that many health service providers have now, where they identify the patient by fingerprint. That is okay. That's a good operational feature, and it makes sure that the people who are actually receiving services are actually the correct people who are insured by this service provider or who are intended to be funded by this service provider. The electronic medical record, of which this is a part, is a critical part of any health information system. But for now, we are talking about financing, remember. And for the purposes of financing, you need a bigger system, a bigger information system, which is the patient centered information system, which is the national human information system, which will tell you who is who in the country. We've seen that one major reason why people fail is because they do not have such a system. A reason why countries fail is because they do not have such a workable system. Let's then move into the exactitudes of this system. When you say health information system, when you say the human information system, a system that identifies indigent and rich individuals, who needs it for purposes of finance? For purposes of finance, the revenue authority of the country will be a critical beneficiary of such an information system. In Africa, generally, we saw that less than half of the population actually pays taxes. Does it mean less than half of the population is earning? No. There are some informal sector practitioners or businessmen who are making much, much more than the salaried employees. And so, if a country relies only on this revenue information system or the PIN number, they will lose a lot of the plot in terms of revenue raising. This system one of the best ways to put it in place practically is to zone the country into different community units, 100 people per village, 20 villages or 40 villages, call them locations or communities, and either use the political process, but more preferred is the community information system, the process, the system of NGOs that can go from one knock from door to door, almost census like, and identify who lives in whichever community, how long they've been there, what their socioeconomic status is, how they can be paid for whenever, how they pay for their health services, and so on. So this is a very intentionally built or produced information system that then informs on the particulars of every individual in the country. It's not impossible. In the era of mobile phones, China has shown that it can be done. In cities like Shanghai, they identify the adult up to up to the facial features. As long as they are walking on the street, they are known, where they work is known, and so on. But we are not looking at such a system that is used for policing and others. We are looking at a system that can identify individuals and their socioeconomic status and so on. Otherwise, whatever is subsidized, very rarely will you find that it goes to all the people who need it. You will lose a lot of money subsidizing the wrong people if you do not have such a system. I think that's important. It's worth repeating. You will lose a lot of money subsidizing the wrong people if you do not have such a system as a country. So always start with a strong information system that actually identifies individuals who need health services but cannot pay for them, and make sure that it is dynamic. Use the community system, the NGOs, the community health workers, the village elders, and so on, and identify who is actually in need. And then keep updating this database. If somebody wins the lottery, update the database. If somebody loses a child, update the database up to the point at which you know that you can at least rely on your information system 99% of the time.